in some countries, especially in the West and the East, they believe Africa is one small village where everybody knows each other. That's the understanding. Now, the tourism, cancellation of tourism, we only picked it up from China. That is specifically because somebody there posted on the website the fact that there is Ebola in South Africa, which means it was factually wrong information. That information was removed after 6 hours, but it has already caused damage. So last month I went to China. Firstly, I started at Chinese University of Hong Kong. I gave a public lecture there, which was attended by professional students, etc. And they were very surprised when I gave them the information, because it's clear that they didn't have correct information. From there, I went to Beijing. I addressed a press conference, but also with travel agencies. They too were relieved, because I gave them a sort of a PowerPoint presentation about the map of Africa related to the rest of the world, about our state of readiness, about all the things we have prepared, and about the fact that there's no Ebola here. I heard from the head of Tourism South Africa in Beijing.
Yes.
When I left 2 days later, I met him in the plane. He said they've made rebookings immediately after that information that I gave them.
Minister,
because that press conference was attended to even by tourism companies. So they made rebookings. I don't think there's been much effect to the tourism in South Africa because it was stopped immediately.
Now, for more on this, we're joined by our reporter Chriselda Lewis live. Chriselda, very good morning to you and welcome.
Well, thank you very much, Elvis. What we're expecting this afternoon is the Health Minister, Aaron Motsoaledi, together with Chief Executive Officers of JSE-listed companies to hold a joint press conference. Now, this partnership comes as a result of the Ebola Response Fund, a fund that was set up several weeks ago in the South African government's response to the crisis in some parts of West Africa. You would know that the detection of the Ebola virus is so far in some of the countries, including Sierra Leone and Liberia, and the South African government basically saying, what is it that we can do to assist those countries? You'd also recall that there was a first team of experts that was sent to Sierra Leone to go and assist with health and humanitarian efforts in that country. That first team has returned and will be part of the press conference today, and we're expected to get a first-hand account of the extent of the spread of the Ebola virus in that country. And we're also expecting to find out how much has been donated to this fund. You know that government has called on several businesses to respond to this crisis that not only affects, even though there is no Ebola in South Africa, as the health minister said during that clip, but of course, if according to some of the experts, this situation is not contained, there needs to be a collective response to this around the world as well as here on the continent. We're also expecting an advisory team to be announced here today. The role of that advisory team, we're not sure at this point what its role will be, but certainly we'll hear during that press conference. But also here behind me, this is part of what we're expecting to be announced this afternoon. As you see behind me here, 4 ambulances that are also part of the response. These are part of the donations that will be sent to the affected countries, and a lot more that we will get, of course, from the health minister during that press conference. But certainly one of the main aspects that we did ask the minister about was relating to some of the travel agencies that we have spoken to, who have said to us that people are already cancelling their bookings to South Africa because they don't understand the geography of Africa, thinking that there is Ebola in South Africa. But the minister says he's travelled, of course, to several countries to try and get the proper information out. And of course, they say, of course, that all the hospitals as well in South Africa, the designated 11 hospitals, are well equipped and they are ready to deal with any eventuality.
Now, you spoke to the minister earlier on. Did he perhaps touch on South Africa's readiness in response to the Ebola outbreak in West Africa?
Well, he certainly did. First of all, what the minister said was that all 11 designated hospitals in South Africa are well equipped, and a majority of the health workers at these facilities have been given the adequate training, for example, on how to diagnose, on how to isolate and treat these patients if it does happen in South Africa. But with regard to the assistance in West Africa, in fact, there's actually a second team. The first team, Elvis, that returned from Sierra Leone will give a first-hand account at this press conference at 1 o'clock, but a second team has already been sent to Sierra Leone to continue with the assistance that South Africa has been giving there. Where these ambulances, where these donations will go to relating to this response fund, the Ebola response fund, we will know, of course, at 1 o'clock how much has been donated to that fund, where the money will go. We'll get to hear a lot more about what other resources have been donated to try and assist with efforts in those countries. But certainly what the minister is saying is that South Africa is ready to stand by with any other assistance. I'm sure these ambulances will leave quite soon to go and attend to the crises in these countries. But certainly, he says, together with there are several ambassadors from Sierra Leone and Liberia as well who will participate in this press conference. Certainly, we will speak to them a bit later on to find out from them what they're saying about their countries and for them to give us a first-hand account of what the extent of this virus is in their countries, which, according to one person who I've spoken to, saying that it's quite devastating, for example, in Liberia.
Chriselda, thank you so much for that update, and we'll keep you posted here on AM News, so don't go away. We'll give you all the relevant details coming from that press conference there a little bit later at 1 o'clock.